For the longest time, the way we've thought about and treated asthma has been, well, pretty much the same. But that's all changing. Right now, we are witnessing the biggest shift in asthma care in decades. And it all starts by rethinking a little device that millions of us see every single day.
That's right. I'm talking about that familiar blue rescue inhaler. The new thinking is so different, so revolutionary, that this absolute go-to for symptom relief is essentially being phased out as a standalone treatment. So what's taking its place? And more importantly, why is this huge change happening now? So let's look back at the old way of doing things. For so long, managing asthma was all about being reactive. You'd feel that wheeze, that shortness of breath, and you'd immediately reach for your blue inhaler. That's a short-acting beta-2 agonist, or SABA for short. And yeah, it gave you quick relief, but we now realize it was like throwing a bucket of water on a fire, but never actually trying to figure out what was causing the fire in the first place.
And this, right here, really gets to the heart of the whole revolution. We are fundamentally shifting our goal. We're moving away from just relieving symptoms to actually controlling the underlying inflammation that causes them. Think about it. The old way was firefighting, always reacting, always rushing to put out the flames of an asthma attack. The new way is about fireproofing the lungs, so those fires have a much harder time starting at all.
And make no mistake, this isn't some slow, gradual shift. The experts are calling it a major step change. It's being driven by brand new joint guidelines from heavy hitters like NICE and the British Thoracic Society. They've essentially created a unified, modern playbook for how we diagnose and treat asthma from here on out.
Okay, so where does this new approach begin? Right at the very start, getting the diagnosis right. We're moving beyond just talking about symptoms and into a world where we can objectively measure what's really going on inside a person's airways. Take a look at the new diagnostic pathway for adults. You can see it's this really logical, step-by-step process. First up, you look for direct signs of inflammation using things like eosinophil counts or a really cool breath test called FeNO. If that's not totally clear, the next steps measure how the airways actually behave. How much they open up after taking medication, or how much they change over a couple of weeks. It's all about building a solid case based on real data, not just guesswork.
And that FeNO test I just mentioned? It's amazing. It's so simple. You just breathe into this little device, and it measures the amount of nitric oxide gas in your breath. Why does that matter? Because that gas is a direct marker for a very specific type of inflammation that's a key hallmark of asthma. Seriously, no needles, no fuss, just a single, simple breath.
Another crucial test is for something called bronchodilator reversibility, or BDR. This is a big one for telling asthma apart from other conditions like COPD. See, with asthma, the airway narrowing is often reversible. So you do a lung function test, take a puff from a reliever inhaler, and then you test again. If there's a big jump in your lung function, that's a very strong clue that you're dealing with asthma.
So, once you have that rock-solid diagnosis, the treatment plan gets a complete makeover too. It's all about being proactive, about tackling that inflammation head-on, and it's built around two new cornerstone strategies.
First up, for people with milder asthma, there's air therapy. Now, instead of just a simple reliever, you use a combination inhaler. This thing has a fast-acting reliever plus an anti-inflammatory steroid, and this is the absolute game changer. Every single time you feel symptoms and reach for your inhaler, you're not just getting relief, you're also actively fighting that underlying inflammation.
And then, for folks who need a bit more daily control, there's this strategy called MART. And honestly, the genius here is just how simple it is. You use the exact same combination inhaler for your daily maintenance dose, and, you guessed it, you also use it as your reliever if symptoms pop up. One device does it all. It simplifies everything and ensures you get that crucial anti-inflammatory medicine every single time you need it.
Okay, so this is the million-dollar question, right? If you're someone who's on one of these older treatment plans, how do you actually make the move to this newer, smarter way of doing things?
Well, the great news is the guidelines make the switch incredibly straightforward. It's basically an integrated upgrade of your old plan. If you were someone who only used a blue reliever when you felt symptoms, you switch to an air therapy inhaler to use as needed. If you were already taking a daily steroid inhaler and using a blue reliever, you switch to a MART plan, which just combines those two jobs into one single device. It's a really logical upgrade to a more effective all-in-one system.
Okay, but what about the folks with really severe asthma, the kind that doesn't respond to these standard inhalers? Well, the revolution doesn't stop there. We're now moving into these incredibly specific,
targeted therapies that go way beyond just inhalers.
These advanced treatments are called monoclonal antibodies. And you can think of them less like a fire extinguisher and more like a set of smart missiles. They are designed to target very, very specific parts of the inflammatory process. Some of them go after the allergic pathway, while others hunt down specific inflammatory cells. Some can even shut down the alarm signals at the very top of that inflammatory cascade before things even get going. This is true personalized medicine right here in action.
So, after all that science, all those new acronyms and strategies, what does this revolution actually mean for the day-to-day life of someone with asthma? Why does any of this really matter?
So what does it all boil down to? It's a total mindset shift, from just rescuing yourself from flare-ups to proactively controlling your condition. We've got more precise tools for a clearer diagnosis, which leads to smarter combination therapies, and that leads to much better outcomes. We're talking fewer severe attacks, fewer trips to the hospital, and just a better overall quality of life. And maybe most importantly, all this new information empowers you to have a much better, more informed conversation with your doctor about your health. It's about taking back control.
So Asthma Care has just taken this massive leap forward. This proactive, anti-inflammatory, personalized approach has totally reshaped the field. It really makes you wonder, with a successful blueprint like this, what other chronic condition is ready for its own revolution?